lips, bradycardia, tiredness, weight gain, anemia. Goiter etc. In goiter, thyroid in neck gets swollen due to iodine deficiency. It is called Graves' disease and also exophthalmic goiter. In this, there is bulging eyes, loss in weight, nervousness, tremor etc. I. Pituitary gland. Pituitary gland is formed by the union of two lobes, adenohypophysis and neurohypophysis. Adenohypophysis is further divided into a. Pars anterior, b. Pars intermedia. Pituitary gland is controlled by hypothalamus and it is itself controls several other endocrine glands. Hormones of pars anterior and their functions. Growth hormone, GH, or somatotropin, STH. Its secretion is depressed by CHIP, growth hormone inhibitory factor or somatostatin, and enhanced by GHRF, growth hormone releasing factor. Its functions are a. Promote protein synthesis during growth and repairing of tissue. b. Stimulate growth of bones, muscles and connective tissue. a. Promote glycogenesis, deamination, gluconcogenesis. I. Prolactin, PRL. Its secretion is enhanced by PRL releasing factor, PRLRF, and depressed by PRL inhibitory factor, PRLIF, of hypothalamus. Its function is to initiate and maintain lactation. I. Follicle stimulating hormone, FSH. It stimulates growth of seminiferous tubules and spermatogenesis in man and growth of ovarian follicle and estrogen hormone in women. IV. Luteinizing hormone, LH, or interstitial cell stimulating hormone, ICSH. In men, it stimulates growth and function of interstitial cells of testes which secrete hormone androgen to regulate development of secondary sexual character. In women, it helps in stimulating ovulation and development of corpus luteum in ovaries. V. Adrenocorticotropin hormone, ACTH. It is regulated by corticotropin releasing factor and it stimulates the adrenal cortex to secrete cortisol. ACTH level is higher in the morning and fall to air lowest about midnight. V. Thyroid stimulating hormone. It controls the growth and secretion of thyroid gland. Hormone of pars intermedia. It secretes the melanocyte stimulating hormone, MSH, in animal, thus controlling skin coloration, but its role in human beings is doubtful. Neurohypophysis. It is also known as pars posterior. It secretes two hormones, I. Oxytocin, A. It increases the forces and frequency of uterine contraction. B. It causes contraction of myoepithelium of mammary alveoli to expel accumulated milk from mammary glands. 1. Antidiuretic hormone, AD, or vasopressin. This hormone has two main functions. A. Antidiuretic effect. It increases the permeability to water of distal convoluted and collecting tubules of nephrons of kidney, thus increasing absorption of water. As osmotic pressure increases, more AD is secreted and water is absorbed, osmotic pressure falls. Less AD is secreted. B. Pressure effect. It stimulates contraction of smooth muscle, especially in blood vessel wall, thus increasing blood pressure. 2. I. Adrenal gland. Adrenal gland is situated on top of each kidney. Each gland has reddish-brown medulla and external, bright yellow cortex. Adrenal cortex is divided into three zones, namely, parts. A. Zona glomerulosa, closely packed columnar cells. B. Zona fasciculata, parallelly arranged prismatic cells. C. Zona reticularis, parallelly arrangement of cell cords. A. Zone glomerulosa produce glucocorticoid hormone which perform following functions. I. Regulation of carbohydrate metabolism. E. Promotion of sodium and water reabsorption from renal tubules. E. Formation of liver glycogen. IV. Gluconeogenesis from protein. V. Depression of body's inflammatory and allergic reactions. V. Stimulate fat absorption from small intestine and redistribute lipids in body. B. Zona fasciculata produces mineralocorticoids. Aldosterone is the mineralocorticoids. It is involved in the maintenance of electrolyte balance by influencing absorption of sodium and water. Renin secreted by kidney converts angiotensinogen to angiotensin which stimulate production of aldosterone, thus affecting electrolyte balance. C. Zona reticularis produces androgens or sex hormones. It is of little significance. They are associated with deposition of protein in muscles and retention of nitrogen, especially in males. Adrenal medulla. It secretes 2 hormone, I. No adrenaline or not epinephrine. It is a neurotransmitter. E. Adrenaline or epinephrine. It carry out following functions. A. Dilates pupil and constrict iris. B. Relaxes smooth muscle of trachea, bronchi, intestine. C. Increases activity of brain and sensory organs. D. Converts glycogen to glucose. E. It dilate coronary artery, constrict peripheral artery, thus raising blood pressure. F. It retard salivary secretion. G. It cause relaxation of urinary bladder and constriction of its sphincters. H. It increases the rate and force of heartbeat. As a result, cardiac output is increased. IV. Pancreas. Pancreas is located in concavity of duodenum behind stomach. It has both exocrine and endocrine functions. The stroma of pancreas contain 1-2 million small endocrine cells known as islet of Langerhans. Each islet of Langerhans contains hundreds of small cells and is richly supplied with blood. In islet of Langerhans, there are 4 major types of cells. A cells secrete glucagon. Glucagon is destroyed by cobalt chloride, destroyed by alloxin. B cells secrete insulin. Insulin is 8 cells. F cells secrete somatostatin. SS. Secrete pancreatic polypeptide. PP. The hormones of pancreas and their functions are as follows. A. Glucagon. Its main function is to elevate blood glucose level. This is done by A. Promoting glycogenolysis. B. Promoting gluconeogenesis. C. Intensifying deamination. A. It also activate adenylate cyclase to form cyclic AMP, thus accelerating deamination of amino acids. B. Insulin. It decreases blood sugar level. This is done by A. Promoting oxidation of sugar. B. Helps in formation and storage of glycogen. A. It inhibits lipolysis in adipose tissue and favors triglyceride synthesis. Other functions of insulin are A. It increases synthesis of messenger RNA, mRNA. B. It stimulates protein synthesis. C. Somatostatin. It retards secretion of insulin, glucagon and pancreatic polypeptide. It also promotes hepatic lipogenesis and demotes lipolysis in adipose tissue. D. Pancreatic polypeptide. It retards secretion of somatostatin. V. Parathyroid gland. Parathyroid gland are 4 oval bodies situated on the back of the thyroid gland in the neck, 2 on each side. Function. I. It maintains calcium level in blood and also regulates the excretion of phosphate in urine. E. It affects structure of bone as it mobilized calcium in blood and bone which stand becoming porous, osteoporosis, due to calcium deficiency in the bone.